Recording in progress.
Good morning, Alexa. Can you hear me? Sounds good. Okay, we're gonna get started soon. So we're gonna have Donna come up first, and then we go from there. Okay.
Welcome to today's webinar hosted by eLotus. We are proud to be your source for quality CEU content, having provided educational courses for over 2 decades. Our goal is to help you elevate your knowledge and expand your skill set. With over 250 speakers and 900 courses and a staggering 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. I'm Donna Chow, your host and moderator, and I'm thrilled to be guiding you through this session. Today's class, Acupuncture Fundamentals in a Community Setting, Part 1, will be presented by the esteemed Alexa Halsey. The class will be from 8 a.m. to 5 p.m. Pacific Time with 4 breaks. Lunch is scheduled from around 12 to 1 p.m. Pacific Time. Before we get started, let me highlight some important Zoom features. Firstly, we have the chat room. It's an excellent tool to connect with your fellow colleagues, and I encourage you to set your chat preference to everyone to make it inclusive. Secondly, the Q&A box is where you can ask your questions for Alexa. Please limit your questions to relevant topics to keep the session organized and efficient. Lastly, for those who qualify, the CEU quiz will be available the following workday, and I'll send you an email when it's ready. Our speaker today is Alexa Halsey, a renowned acupuncturist and entrepreneur who founded Encircle Acupuncture in Nashville, Tennessee in 2010. Her mission was to make acupuncture services affordable and accessible to more people, and her clinic has since expanded to 2 locations and a team of multiple acupuncturists. Encircle has provided over 200,000 affordable treatments to date and is one of the busiest community acupuncture clinics in North America. Alexa's newest project is Community AcuHub, an online resource center for community acupuncturists. Alexa has been teaching with eLotus since 2021, and you can find her other great presentations on elotus.org. We are honored to have her here today to share her expertise and experience in the field of acupuncture. Now let's dive into today's class and learn something new. Alexa, please feel free to take over and share your presentation.
Thank you, Donna. Thank you so much. I'm so excited to be here and talking about one of my favorite topics, which is community acupuncture. So I'm going to go ahead and share my slides. Here we go. And we're going to hit play. All right. So hopefully everybody can see my screen now. If you can't, somebody just speak up and I'll see what I need to do.
Yeah,
but
we
hopefully
see
you can
it loud and clear, and then we see the PowerPoint.
Okay, perfect. All right. Well, welcome to part 1 of Acupuncture Fundamentals in a Community Setting. I'm Alexa. I am passionate about community acupuncture and I'm really excited to share more about it with all of you. So as Donna mentioned, this class goes from 8 to 5. We'll have some breaks and I'll talk a little more in a minute about what to expect from the format of today's course. I would love to know who all is here. I'm keeping an eye on the list of participants, and I know that some of you have already introduced yourself in the chat, so thank you for doing that. If you haven't, go ahead and introduce yourself in the chat. And I would also love to hear from you if there is anything in particular that you're hoping to learn from this course. And that helps me to just know where to direct the information. I want to make sure everybody's getting what they are hoping to learn out of this course. So you can go ahead and post that in the chat as well. And then when we're on a break, I will review all of that and make sure I'm covering all the bases. So while you're introducing yourself and tell us where you're zooming in from and what you would like to learn, while you're doing that, I am going to introduce myself, talk about what to expect from this course. But first, I would like to start by reading a poem. And I would like to dedicate this poem to all of my fellow community acupuncturists and to the ones who taught me about community acupuncture when I was just starting out. And also to my community acupuncture colleagues who continue to teach me by sharing their ideas and their successes and failures. I'm grateful to each and every one of you. So this poem is To Be of Use by Marge Piercy. The people I love best jump into work head first, without dallying in the shallows, and swim off with sure strokes almost out of sight. They seem to become natives of that element, the black, sleek heads of seals, bouncing like half-submerged balls. I love people who harness themselves, an ox to a heavy cart, who pull like water buffalo with massive patience, who strain in the mud and the muck to move things forward, who do what has to be done again and again. I want to be with people who submerge in the task, who go into the fields to harvest and work in a row and pass the bags along, who are not parlor generals and field deserters, but move in common rhythm when the food must come in or the fire must be put out. The work of the world is common as mud. Botched, it smears the hands, crumbles to dust. But the thing worth doing well done has a shape that satisfies, clean and evident. Greek amphoras for wine or oil, Hopi vases that held corn are put in museums, but you know they were made to be used. The pitcher cries for water to carry and a person for work that is real. And I like this poem because it just reminds me of our medicine. Our medicine is meant to be used and to help people. And that is what we try to do with community acupuncture. So I'll introduce myself a little bit. I've been practicing acupuncture since 2005, and for the first 5 years of my practice, I worked in a private room setting. And then after 5 years, I decided to start doing community acupuncture. And for the first 5 years of my practice, I loved seeing patients. I loved learning what all this medicine can do and just getting started and discovering how amazing this medicine is. But I was frustrated in my practice because I wasn't seeing as many patients as I wanted to be seeing. And I was struggling to earn a living as an acupuncturist. And I felt like there were a couple of things going on. One is that a lot of people just never came to see me in the first place because the price was too high. They were on a budget. They were maybe interested in acupuncture, but once they learned about the price, it was exclusionary. And then another thing that happened is that patients would come in and they'd get a few treatments, they would start feeling better, and then they would stop getting acupuncture. And again, it was primarily because of the price. They just couldn't come as often enough or as frequently enough to really get the maximum benefit of acupuncture. And so I was really looking for a way to reach more patients and to build my own practice and to earn more of a stable income for myself. And I learned about the community acupuncture model. And community acupuncture was already being practiced by a number of clinics in the United States by the time I came to learn about it. And so I really learned the model that was originated in the United States at Working Class Acupuncture in Portland, Oregon. So they started practicing this style of acupuncture and started teaching other acupuncturists about it, and it sort of spread across the continent. And so that's how I learned community acupuncture. And I have since been very involved with other people doing community acupuncture. I love to stay in touch with other community acupuncturists, learn from one another and exchange ideas and just grow together. So I started Encircle Acupuncture in 2010. It's in Nashville, Tennessee, and we have expanded to 2 locations. We have 2 locations. I have 8 acupuncturists on staff and admin staff. In our busiest time, pre-pandemic, we were providing about 30,000 treatments a year. And we're not quite back to that level yet, but we stay busy. We are open 7 days a week. We routinely have patients come in from far away because there's no other affordable acupuncture option in their region, or maybe no acupuncture option at all. So when we opened in 2010, there were only a handful of practitioners in our area, and there still aren't very many. But I feel like we have really helped to introduce acupuncture to a large portion of the population in our region. And that's one of the great things about community acupuncture too. It helps more people know about acupuncture and all of the benefits of it. So that's Encircle Acupuncture, my clinic. There's my website, and I'll share my contact information at the end. You can check out the website and see what we're all about. So another of my projects is Open Acu, which is an appointment scheduling and EHR software for acupuncturists. So this system, Open Acu, was developed by one of my patients. And he was one of my patients very early on, and we didn't have online appointment scheduling. And he came in one day and asked why I didn't have online appointment scheduling. And this was over a decade ago. And it was back when a lot of acupuncturists weren't using online scheduling. And I said, well, I've looked at the systems out there. I don't really like anything. And he said, well, how about I create an appointment scheduling system for you? And he did, and then rolled it out to other community acupuncture clinics as well. So we have a number of other users. A little while later, we incorporated an EHR component, so it's integrated with an EHR, and we've also incorporated payments method. So we have integrated credit card payments with the system as well. So that is Open Acu. I'm going to talk later on in the presentation about appointment scheduling and EHR and some of those systems that you need. And I'll share at the end a special offer for webinar attendees for the Open Acu system if you're interested. So I'm also a writer and a podcaster, and I write a newsletter called Notes from Your Acupuncturist. It's on Substack, and you can subscribe to that for free. And I host a podcast of the same name, Notes from Your Acupuncturist. And I started writing and podcasting because I wanted to find a way to just get more information about acupuncture and Chinese medicine and all of the things that it does. I wanted to get it out there to more people. And I also wanted a way to answer a lot of the questions that I get from patients. So one of the things in community acupuncture, we don't have a lot of time to talk with patients and get into really interesting discussions about Chinese medicine theory, which I enjoy, but community acupuncture is so fast-paced. So I started writing as a way of sharing this information with my patients and with anyone else who is interested. And then I added a podcast to that as well. On my podcast, I will talk about whatever I find interesting about acupuncture. And I also have guests on my podcast. I interview colleagues, my fellow acupuncturists, because we all have something interesting to share about our medicine. I'm always looking for podcast guests. So if you're an acupuncturist and you're interested in coming on the podcast and talking about whatever you want to talk about, let me know. And again, I'll share my contact information at the end. I love talking to other acupuncturists. So that's Notes from Your Acupuncturist. And then, as Donna mentioned, my latest project is Community Acu Hub. This is a work in progress, and it is an online resource center for community acupuncturists. We have monthly meetups. I'm compiling free resources. We're starting to do some lunch and learns. And this is just a way for community acupuncturists to stay in touch, stay connected, and learn from one another. So that's the Community AcuHub website, and you can subscribe to our email list on the website. I also have an events calendar on the website, and you can register for an event. Everything is free. It's just a way for us to stay connected, because community is really important when you're doing community acupuncture. And I'll talk a bit more about that. So why I wanted to teach this course. I want to see more community acupuncture clinics. Community acupuncture has so many benefits. It fills a need for so many patients, and it serves a lot of patients who would not otherwise be getting acupuncture. So it's a really important way to increase utilization rates of acupuncture, and of course to help more people. So I'd love to see more clinics everywhere. Patients are always asking me if I have referrals to clinics in other location for their friends and family. I love it when I can refer them. A lot of times I can't because there's just not another community acupuncture clinic in their area. So in community acupuncture, we celebrate the opening of new clinics. So that's one of the reasons why I'm here. I also just want to share some fundamental concepts and keys for success. I've been doing community acupuncture for 13 years now. I've made a number of mistakes and learned some good lessons and figured out some good systems. So I just want to share that with everyone. And again, build community. So community acupuncture is a wonderful way to practice, but it has its challenges. It's not always easy. And it really helps to be in touch with other acupuncturists doing this same work. We can all learn from one another. We can exchange ideas, just support one another when we're having a challenging time. So that's why I created Community Acu Hub. And it's just a way for us to be in community together, doing community acupuncture. So the course objectives for part 1. First, identify the economic and social forces that limit patients' access to acupuncture, and how community acupuncture offers a solution that benefits patients, practitioners, and communities. 2, understand the core concepts of community acupuncture, including key features, mindset, and models of care. 3, envision the type of community acupuncture practice that aligns with your unique values, skills, and strengths. And 4, understand the essential building blocks to launch a community acupuncture practice. So, what to expect from this course? So part 1 today is mostly going to be about the what and why of community acupuncture. And part 2, tomorrow's course, is going to be more about the how of community acupuncture. There's going to be some overlap. Today, we're going to discuss why it's important, what its benefits are, what exactly is community acupuncture, and how to develop your unique approach to it, and what you envision your community acupuncture practice to be. By the end of today, hopefully you'll have a solid foundation of the what and why, and both for you as an individual practitioner and on the larger macro level. And then in part 2, we're going to talk about how to bring all of that to life. There are many ways to have a community acupuncture clinic. So mine is a big clinic with multiple locations and staff. We solely do community acupuncture. We don't do anything else besides community acupuncture. Other clinics are small solo operations. Some are hybrids of community acupuncture and private acupuncture. Some offer other modalities besides acupuncture. So during this workshop, I'm going to give examples from my own practice. And I also know a lot of other practitioners doing community acupuncture. And so I've gotten some input from them for this webinar, because not every practice is like mine. So like I said, we only do community acupuncture. So for clinics who are doing hybrid clinics, community and private, I ask them for some input on how all that works. So I'm going to be presenting from my own experience, but I've tried to incorporate perspectives from other practitioners as well. And again, there's no one singular right way to do it. So today's course is going to be divided into a few different sections with breaks. I'm going to take questions after each break. So the break time will be a time for you to type your questions and think about your questions, and then I'll answer them after the break. If you have questions specifically for me, use the Q&A section, because that is what I will check when I'm answering questions. You can use the chat to talk to each other. That's great. And then later on in the course, I'm going to pose some questions for you and ask you to share your responses in the chat if you like. But if it's anything specifically for me, just use the Q&A, and that way I'll make sure I answer everything. Okay, so we're going to dive in and talk about why community acupuncture, and we're going to start with talking about the economic realities. And I am talking from the perspective of someone in the United States, and so we're going to be talking about economic realities in the United States. If you are outside of the United States, obviously the economic reality in your area is going to be different. And I encourage you to, think about how that might impact your practice if you're practicing outside of the United States. I'm spending some time on this because the more you understand the economic forces that impact the practice of acupuncture and the economic benefits of community acupuncture, I feel like the more invested you're going to be in making it work. And really, that's crucial for making it work, is that investment and that commitment. And so it's very helpful to understand the economic and social underpinnings to commit to practicing in this way. When I started doing community acupuncture, I had no backup plan. I had just moved, so I was in a new city. I wasn't practicing anywhere else. I had to make it work. And I believe that's part of the reason why I've been successful. I was all in on this model. I still am. And I want you to be all in too if you're doing this. So this morning, we're going to talk a lot about a lot of big picture stuff, because it's really the foundation of why we do this. And then we'll build upon it with specifics about how to do community acupuncture, of course. But first, I want to look at why it matters and what it is and what it isn't. So we've all heard this line. I remember hearing it back when I was in acupuncture school, and I still hear it, that if people value their health enough, that they will find a way to pay for acupuncture. So I want to set aside the notion of what valuing your health means, because that's a big statement to get into. So I want to look at some economic realities. So in 2022, the median personal income in the United States before taxes was $44,225 annually. That's for an individual, or $3,685 per month. That's median individual income. Median household income, so this is for a family of about 4 people, median income before taxes in 2022 was $61,937, or $5,161 per month. So according to the U.S. Bureau of Labor Statistics, the average U.S. household spends about 84% of their after-tax income on housing, transportation, food, and other essentials. And so this leaves about 16% of their after-tax income for other expenses. So here we see it in a pie chart. We've got all of these different categories. Housing is a big one, transportation, taxes, utilities, and so forth. I want to point out that the average household spends 6% of their after-tax income on healthcare. But this does not include acupuncture. These are things like insurance premiums, copays, and prescriptions. So anything beyond premiums, copays, and prescriptions, that falls into the other category, which again is about 16% of after-tax income. So for an individual making $44,225 per year, Their estimated take-home pay per month after taxes is $3,152. And that means that they have $504 to spend on all non-essential, non-budgeted expenses. So that's $504 in their pocket for everything that's non-essential. And for a family of 4, their estimated take-home pay after taxes is $4,767. So that's $763 a month to spend on non-essential, non-budgeted expenses for a family of 4. So again, not very much. That's just, about $125, $150 a week for a family of 4. So let's say a private acupuncture session costs $95 a treatment. I'm using that figure because that's the average cost in my area. It's easy to see why many individuals and families just don't have the budget to pay for acupuncture. That on that median income, an individual could afford 5.3 treatments per month, or a member of a family of 4 could afford 8 treatments per month. And that's if they allocated all of their discretionary spending solely for acupuncture. So that's not including emergencies. That's not including any extras. So the reality is that for the average American, the numbers just don't work out for them to get regular acupuncture. I mean, maybe, yes, treatments every now and then if they really need it. But if they want to make it a regular part of their healthcare routine, most people just don't have the budget. So it's really not about what they value, and it's more about what they can afford and what they can allocate their budget to, because things come up, emergencies happen, they have to spend money on other things. So yeah, there are very real economic barriers to people being able to get acupuncture at a price of about $95 a session. So another way to look at it is by household income statistics. So 38% of US households are considered low income, so that's earning less than $50,000 a year. 44% are considered middle class, and that's earning $50,000 to $150,000 per year. And again, this is for a household, not an individual. And then 18% are considered upper class, and that's earning $150,000 or more per year. So here it is in pie chart form. And you can see that the smallest percentage are people considered upper class earning more than $150,000 annually. So realistically, private acupuncture at full price, people paying out of pocket at an average of $95 a treatment, that is offered at a price in most cases that only about 18% of Americans can afford. And a few more sobering statistics. I promise things are going to look up from here, but I just want to lay some groundwork of what the reality is. The amount of medical debt in the United States is estimated to be anywhere from $88 billion to $195 billion. So people have a lot of medical debt in this country. 63% of people have said they've had to cut back on food and basic necessities to stay on top of medical bills. So if people are cutting back on their essentials like food and utilities to pay already existing medical bills, it's no wonder that they're not then paying out of pocket for acupuncture too. 41% of adults in the US have some form of medical or dental debt. 41%. That is a lot of people. About 1 in 6 Americans have used personal loans to pay for medical bills. The interest rate on personal loans is usually very high, so then that's adding more to their debt. Again, it's easy to see why people just don't have the budget for acupuncture. Households in the bottom fifth of income groups pay an average of 33.9% of their income towards healthcare, while families in the highest group pay only 16% of their income towards healthcare. So people in the lower income groups are just less able to afford it from a pure dollars and cents perspective, but also when we're looking at percentages of what they're paying for other expenses. So it's tough out there for a lot of Americans. They don't have a lot of extra spending money, and people don't see why acupuncture should be something that they pay out of pocket for when they have so many other bills, debts, and expenses that they have to allocate their resources towards. Here are just some sources of where I got all these statistics if you want to look those up. So, potential solutions to the problem of acupuncture affordability. The good news is we have lots of solutions. So, we're done with the sad, depressing part of the morning, and we're going to talk about solutions now. Community acupuncture is one solution, and I think it's a very effective solution that benefits everyone involved. But there are other solutions too. So I briefly want to talk about all of these, and then we'll dive into the benefits of community acupuncture. So one solution is discounts. So this is something that a lot of private room practitioners will offer. They'll offer discounted treatments from time to time. Maybe it's for somebody who really needs their services but is on a budget. Maybe they've had some sort of financial shortfall. Maybe it's for somebody who needs a lot of treatment in a short amount of time. So discounts can be a really helpful solution. The challenge here, I think, is twofold. One is that offering discounts in a way that respects the dignity of the person on the receiving end of the discount. That's one challenge. I remember seeing one website that talked about their prices. They were a private room acupuncture clinic. They talked about their prices, and then they talked about what they called hardship cases, and offering discounts for hardship cases. And for me, if I were the patient, I don't know if I would want to think of myself as a hardship case. And then the process for requesting the discount isn't always clear. People don't want to prove that people don't want to feel like they have to prove that their financial situation is so dire that they need a special rate. Sometimes people are embarrassed about having to ask for a discount because they really they do value their health. They do value the services that you're offering, but it's just not affordable for them. So they might feel embarrassed about asking or being referred to as, something like a hardship case. So what happens, a lot of people just won't ask. They'll write off the possibility of even getting acupuncture as soon as they find out the cost. The second challenge with discounts is for the practitioner, because you have to figure out how to sustainably offer discounts. If you're seeing patients in a private room, you can't have too many people getting discounts, because then you won't earn enough money to support yourself. So you have to think about, do you have a quota for discounts? How much do you discount? And what's the process for applying? And what kind of time limits do you set? And all of that. It becomes complicated quickly. So discounts can be beneficial, but in the end, I feel like they end up benefiting a small number of patients. So another potential solution is volunteer work, and volunteer work is great. It helps people. It exposes new people to the benefits of acupuncture. It can be very meaningful and fulfilling for practitioners as well, and feel like you're giving back. The one obvious drawback to volunteer work is that it doesn't pay the bills. So I don't want to discourage anyone from doing volunteer work. It's great to do, But unless you're just independently wealthy, it can't be the core of your practice. So another solution is private insurance. And for patients who have private insurance coverage for acupuncture, this is a great solution. But it's a really small segment of the population. So there was a 2012 study. So granted, the study is over 10 years old now. But there was a 2012 study that showed, that looked at acupuncture, insurance coverage for acupuncture. And it showed that 75% of Americans had no coverage for acupuncture, 16.5% had partial coverage, and 8.5% had full coverage. So things have probably shifted, or maybe shifted a little bit since this study, but I don't know that they have shifted all of that much. And I think that private insurance coverage and full private insurance coverage for acupuncture is still pretty rare. So again, you're only really helping out a small portion of the population if private insurance billing is your only solution to the problem of acupuncture affordability. And then the other thing with private insurance coverage is that, what is the cost to the practitioner as well? It's complicated to bill insurance. As a practitioner, you can do it yourself, or you can pay someone else. Regardless, there's a cost to it. There's either the cost of your time or the money that you pay to someone else to bill for you. From what I understand, the rules change a lot and the reimbursement amounts change a lot. There's extra work of verifying coverage and getting paid and chasing down payments. For me personally, I don't want to spend my administrative time doing that kind of work, and I don't want the added expense of an insurance biller. So another potential solution is Medicare. And as most of you probably know, Medicare in the United States now covers acupuncture for lower back pain, but licensed acupuncturists are not yet federally recognized providers. And I'll talk more about Medicare in a bit. But the current primary drawback of Medicare is that coverage is so limited. It only covers one condition and only for a certain number of visits. And that will probably change. It will probably expand to cover more conditions. But that's a state of Medicare coverage right now. It's a very limited solution. And then finally, we have community acupuncture. So community acupuncture is very simple to implement. It's very respectful and inclusive. It doesn't limit who can be treated or what conditions can be treated. It provides stable income for acupuncturists, and it makes acupuncture available to many people who otherwise wouldn't be using it. I feel that it is the most widely encompassing solution to the problem of access and affordability. It's not the only solution, but it's the one that provides the most benefits for patients, practitioners, and communities. So let's get into what are some of these benefits. I'm going to talk about how community acupuncture benefits three segments of the population: patients, practitioners, and the communities. And I'm going to start with patients. So let's talk about general barriers to healthcare access. So these are barriers. These are not just for acupuncture. This is for any type of healthcare in the United States. There are a lot of barriers to healthcare access across the board in the United States. We have a very imperfect healthcare system here in the US. As acupuncturists, we can be part of the solution of increasing access And that's one of the things that I love about community acupuncture, is that I feel like I am part of the solution for my patients on an individual level, because I'm helping them with their pain or their anxiety or whatever it is that they're coming in for. But I also feel like I am part of the larger solution of healthcare access, in my own small way at my clinic in my town. I am part of the solution of getting people access to good quality healthcare. So these are the general barriers. One is limited appointment availability and office hours. So if you have had any contact anytime with the allopathic medical care system in the United States, you know this. It takes a very long time to see a specialist or to schedule a procedure. I have patients tell me all the time that they are having to wait months to get in to see a rheumatologist. Or, I was talking to a patient yesterday, and she has she thinks that she tore a meniscus and she can't get an MRI for a few weeks. And so meanwhile, she's just trying to baby it as much as she can. So yeah, there's limitations to when you can even get in to see a healthcare provider. This is why we see the rise of things like urgent care centers and clinics inside pharmacies, like the Minute Clinic and at Walgreens or wherever it is. Most traditional doctor's offices are open 9 to 5-ish hours, but people need more flexibility in when they can access healthcare. If your acupuncture clinic is open 9 to 5 Monday through Friday and that's it, that's a whole lot of patients who will never be able to get acupuncture from you just because of your hours. Not everybody has a flexible work schedule. So that's a big barrier. Another is geographic clinician shortage issues, especially in rural areas. And when we're talking about acupuncture, it doesn't just affect patients in rural areas, because as we know, acupuncturists tend to cluster together and practice in same locations in certain states or in major metropolitan areas or near where the acupuncture schools are. And so patients outside of those areas might not have access to anyone who is a licensed acupuncture. And so what ends up happening is that either patients don't get acupuncture at all, they don't even think about getting acupuncture because there's no one anywhere near who does it, or maybe they drive long distance to get acupuncture. We have a lot of people who do that. And I'm glad that people are willing to do that. I hate that people have to sit in a car for an hour to just come and get acupuncture, but it's better than nothing. And also what ends up happening is that people who aren't licensed acupuncturists will end up being the acupuncture providers. People like physical therapists and MDs and chiropractors end up providing acupuncture if there's not a licensed acupuncturist nearby. And I know that there is a lot of talk in our profession about who should be providing acupuncture and who shouldn't be providing acupuncture, but we also should be talking about what happens if there is no licensed acupuncturist to serve a geographic area. So for example, I live in Tennessee. Tennessee has a population of almost 7 million people, and it's over 400 miles from one end to the other. It's a really long state. And there are 219 licensed acupuncturists in the state of Tennessee. That's not very many. I have patients who will routinely drive over an hour to see me, and I think probably most other acupuncturists in this region will report the same thing. It's not because I'm the world's greatest acupuncturist. It's just because there's no one closer. So geographic barriers are a big problem. Another barrier is transportation barriers. So there are approximately, there's statistics showing that approximately 3.5 million patients go without healthcare because they cannot access transportation to get to their providers. That's a lot of people not accessing healthcare just because of transportation issues. So community acupuncture certainly does not completely solve the problem of transportation issues. We live in a car-centric society for the most part, and not everyone has a car. And if you don't have a car, then it's hard to get places. We do have patients who will take the bus to come to our clinic, and sometimes it takes them 2 hours on the bus to get to the clinic. But community acupuncture does offer a really simple solution to this problem. And it doesn't completely eliminate the problem, but it does help. And community acupuncture makes it really easy for people to come in and get treated together. So a patient and the person who's giving them a ride can come in at the same time and both be treated for a low cost and both be in and out in an hour. And this happens at my clinic all the time. Somebody starts coming to acupuncture, they need help getting to acupuncture because they don't have transportation. And so a friend starts driving them to acupuncture, and then the friend starts getting acupuncture with them at the same time. And then it just becomes something that they do together. So that is a nice solution. It doesn't solve the entire problem of transportation, but it is really a creative way that community acupuncture helps to address this problem. So another barrier is limited education about care sites. And what this means really is there's a lack of understanding among patients about the type of care facility that they should visit, particularly non-emergency care facilities. So people just don't always know where to go, who to go, what practitioner to see, where to go if it's not an emergency. And I think in our case, what we can translate this to mean is that there's a lack of education among the general population about what acupuncture is, what it does, and what it's used for. And a lot of that is because there are many, many people out there who don't know anyone who's ever gotten acupuncture. And so they don't know who to ask, they don't know what to ask. It's just not even in their mind, because maybe there's not an acupuncturist in their area. So no one in their area gets acupuncture. And so then nobody thinks about acupuncture. So community acupuncture helps more people get acupuncture and try it. And then more people are talking about it and bringing in their friends and family, and educating our patients, educate each other about what it is and what it does. So another barrier, of course, is high cost. This is definitely a problem in the United States with the high cost of healthcare. And this is a primary barrier that community acupuncture seeks to address. We want to lower the cost of treatment. And then another barrier is social determinants of health. If you're an acupuncturist, you have probably had patients tell you stories about negative experiences they've had in the healthcare system. And I think that's one of the reasons why patients love acupuncture. First of all, it works, it helps them, but also it's just a different kind of experience than it is going to a doctor's office. Acupuncturists just approach treatment in a very different way. So patients have negative experiences in healthcare, which then we can turn into a positive in acupuncture settings. But this is especially true for marginalized patient groups. And this includes people of color, immigrants, LGBTQ patients. So community acupuncture addresses this because our clinics are extremely inclusive spaces that welcome everyone, and there's a very low barrier for entry. And so what I mean by a low barrier for entry is just first of all, the cost is low, but also it's just ease of access. It's easy to make an appointment. We try to locate clinics in areas that are accessible. It's not overly complicated to make an appointment and come in and get treated. It's an unintimidating space. It's an unintimidating type of reaction. And that's a huge way that we reduce barriers. So community acupuncture is really an opportunity to redefine the patient-practitioner relationship and to make it one that is inclusive, holistic, and rooted in trust and acceptance, and to make that kind of relationship available to patients who have historically been excluded from this particular type of healthcare interaction. So while we're talking about benefits for patients, I want to talk about utilization rates as well. In the United States, data from the National Health Interview Survey showed a 50% increase in the number of acupuncture users between 2002 and 2012. So that's good news. In 2012, and this 2012 is, again, it's more than a decade old, but it's the most recent year for which statistics are available. In 2012, 6.4% of US adults reported that they had used acupuncture once in their lifetime, and 1.7% reported that they had used it in the past 12 months. So it increased in the 10 years from 2002 to 2012, but still pretty low. Only 1.7% of US adults had used acupuncture in the last 12 months. By contrast, the same study showed that 8.3% of Americans had had chiropractic in the last 12 months, and 6.9% had had massage. So a lot more Americans are getting both massage and chiropractic care than they are getting acupuncture. So really what this means is that there are a lot more people out there who could be getting acupuncture and benefiting from it. And I don't have to make the case that more people should be getting acupuncture. I mean, we're all acupuncturists here. We all know how well acupuncture works. And I think that we can all agree that more people getting acupuncture is a good thing. But it's about more than just getting people to try acupuncture once. We know as acupuncturists that acupuncture is generally most effective when it's done regularly and frequently. And this especially applies to acute conditions or in the early stages of treatment. Acupuncture is also great for prevention. And treatment plans, I feel, are best determined by the practitioner and the patient, and not a third-party payer like an insurance company or Medicare that's going to say, okay, you can only have so many treatments in this amount of time, and it's only going to be for these certain conditions. I think it's better to let practitioners and patients determine that. And insurance is not going to pay for acupuncture for prevention. You know, if somebody is going to be traveling and they want to keep their immune system healthy and want to do some treatments for that, that's not billable for insurance. So we want people to try acupuncture, but we also want people to get acupuncture on a regular basis. We want people to use it in however way they want to use it and not determined by someone else. And we want patients to really be able to access acupuncture as often as they need it. So those are some of the primary benefits of community acupuncture for patients. It just really offers a lot of solutions for patients that give them more flexibility, that give them more control over their healthcare and more choice in what tools they use for healthcare. And it lowers barriers to healthcare for patients. So yeah, community acupuncture helps patients get the most out of acupuncture. It offers services at a cost that's low enough for people to come in as often as needed. It encourages patients to come in even when there's nothing wrong. I mean, I have a lot of patients who come in and say they just want to relax today. And at my clinic, we'll get into pricing a little later. At my clinic, we charge $25 to $50 per treatment on a sliding scale. And so somebody just wants to come in and relax, they can pay $25 for that. For a lot of people, $25 is not too much to pay to just come in and relax for an hour and get some stress relief. And it allows practitioners and patients to determine treatment plans and not be constrained by insurance. So those are the benefits for patients. And now we're going to talk about benefits for the profession. So in the past, community acupuncture, especially when it's first getting started in this country, community acupuncture would be accused of devaluing the profession. Sometimes it's called the Walmart of acupuncture because we charge lower rates in community acupuncture than in private room acupuncture. And so I'm going to talk about how that is not really the case. So let's talk about some challenges facing the acupuncture profession. I don't know if anybody attended the town hall in January that the American Society of Acupuncturists did. That was in January of this year, 2023. And they laid out some very clear challenges that are facing the profession. You can watch the recording of that town hall meeting. And if you haven't watched it, I encourage you to do so. It's a lot of great information. So here are some of the challenges that they laid out in that presentation. One is lack of access. Now, I think of lack of access as patients not being able to access acupuncture. But what they really focused on in this presentation, the ASA, is that acupuncturists currently don't have access to patients who use Medicare because we're not federally recognized providers. And currently that's about 60 million patients who use Medicare. And it's soon to be up to 80 million patients. So lack of access is one. Another big challenge facing the profession is debt to income ratios. This again is information from that presentation in January. The average acupuncture school graduate earns less than $50,000 a year 3 years after graduation, and that is regardless of the type of degree that they earned. The average debt load for an acupuncturist is $100,000 for acupuncturists who have earned a master's, $200,000 for acupuncturists who've earned a doctorate, and $250,000 for people who have gone through the first professional doctorate program. So that's anywhere from $100,000 to $250,000 is the average debt load for an acupuncture graduate, and they're earning less than $50,000 per year in the 3 years after graduation. The Consumer Financial Protection Bureau recommends that total student loan debt shouldn't be more than you plan to earn in the first year after graduation. So ideally, acupuncturists should have less than $50,000 in student loan debt. And right now we are nowhere near that neighborhood. Acupuncture education is expensive, and people's salaries, or just the amount of money that they earn, just really don't line up with these debt loads. Another challenge is few job options, very few job options out there. Most acupuncturists end up going into business for themselves in one way or another. Maybe it's opening their own clinic, maybe it's getting an independent contractor position, which is basically being self-employed. There's very few actual jobs. And then another challenge that they laid out is barriers to small business loans. So if you do want to open your own clinic and start start your own business. That does take money, but most acupuncturists can't access small business loans because of their debt load and because of their earnings. They just don't qualify for small business loans. And then some other challenges facing the profession. These are my own opinion and based on observation. One is that acupuncturists lack the training and the skills to run a business. And most acupuncture schools teach a very limited practice management education, and the skills to run a business are skills that anyone can learn, I believe, but learning them is a big lift, and it requires a lot of work. And most acupuncturists, is a big hurdle to learn all the skills that you need to be an acupuncturist, and then additional skills to start and run a business. Most acupuncture practices are not generating enough revenue to hire a full-time practice manager. So you need someone to manage customer service, training, marketing, bookkeeping, inventory, just day-to-day operations. It's a lot. It never ends. And then that's not even to mention insurance billing. So a lot of acupuncturists are trying to do all of that themselves without necessarily knowing the best way to do those things. Another challenge is that acupuncturists with busy practices, they struggle to recruit and retain talent. This has been my experience for many years, and it's often a geography issue. So again, acupuncturists will often cluster in major metropolitan areas or around where the schools are. Where I live in Nashville, there aren't any schools in our state. There's a couple of schools in the next state over. So we're always having to import people to come and work at the clinic. So acupuncturists, if they're going to relocate for a job, then it needs to be a good job. So yeah, I think that there are issues of geography and economics all tied up in that. I've always said I'll open more clinics when I can find more acupuncturists, and that's been a challenge. And then another challenge that I see a lot, and that all of us have seen, is that acupuncturists struggle to earn a living. This was certainly my experience getting started. And of course, a lot of people have this issue when they're first starting out, they're first graduating and building a practice. It takes time, of course. You're not gonna be busy right away. You're not gonna be making a lot of money right away. That's normal. But I see this happening too for acupuncturists who have been in practice for years. And I think this happens is that because acupuncturists just don't have a reliable, steady stream of patients in their practices. And community acupuncture offers a solution for that. So I'm going to talk about how community acupuncture addresses these challenges facing the profession. So one is that the low cost of community acupuncture makes Medicare billing unnecessary. Again, at my clinic, we charge on a sliding scale of $25 to $50 per treatment. And, that's about in line with what other clinics charge. Some clinics in other areas charge a little more if it's a more expensive area. And again, we'll get into pricing later. I treat a lot of patients who are on Medicare, as do many community acupuncturists. And Medicare patients are already coming to us because the cost is very low. Also, the cost for patients who have private insurance, the cost of a treatment at a community acupuncture clinic is about the same price as a copay. So you can sort of eliminate all of the complexity And the headache and the potential mistakes of insurance billing and Medicare billing, you just sort of cut that out because you're just taking direct payment from the patient and it's at a price point that they can afford. So another benefit of community acupuncture, it creates jobs for acupuncturists. And these are real jobs. These are W-2 employee jobs with a stable living wage and a predictable paycheck and predictable hours and benefits. At my clinic, we offer things like paid time off and a retirement plan. We create a lot of stability for acupuncturists. Some of the acupuncturists at my clinic work solely at my clinic, and that's what they do full time. Others work part time at my clinic, and then they do private practice on the side because they like, having the mix of the two different styles. But community acupuncture provides a lot of stability for the people doing the acupuncture. So that's another benefit. Some community acupuncture clinics are nonprofits. And that means that the people who work there could be eligible for student loan forgiveness under the public student loan forgiveness program. For those that aren't nonprofits, that's not a benefit. My clinic is a for-profit. But again, we provide stable living wage jobs. Another benefit is low startup costs. So the ASA presentation talked about not having access to business loans, small business loans. Well, you don't really need a small business loan to start a community acupuncture clinic because it doesn't cost very much. I funded my startup of my clinic on credit cards, which admittedly is not the best way to finance starting a business, but it was the only option that I had. I didn't have any savings. And so if I wanted to do it, I had to go into some debt. I spent $8,000 on my startup, and I was able to pay that off within a year. And since then, the clinic has been debt-free for the most part, except for another time when we made a big move and spent some money on that, and then financed some of that with a line of credit. Again, paid that off within a year. So even if you are taking on some debt as a community acupuncture clinic, it's usually a very low amount, and it's very manageable to pay that off in a short amount of time. So yeah, I financed it on credit cards. I paid off the debt within a year, and I was able to start paying myself within 3 months of being open. And I didn't pay myself a ton at first, but I was operating in the black pretty quickly. So it's a financial commitment, certainly. But it's not one that is going to bankrupt you as a practitioner. It is a manageable amount of debt if you're going to take on debt, and if you're going to fund with savings, then hopefully won't deplete your savings, and you'll be able to pay yourself back. Another benefit for the profession is simple, streamlined practice management. When you are a community acupuncture clinic owner, there's always a lot of business stuff to do, always. But when you have good systems in place, the day-to-day practice kind of runs itself. Again, you don't need to bill insurance, so you don't have to deal with that headache. And the patients do most of the marketing for you. So that's another benefit. Community acupuncture also provides stable income for acupuncturists, not just employee acupuncturists, but also the acupuncturists who own the community acupuncture clinics. Of course, nothing is guaranteed, but a community acupuncture practice is generally pretty stable. And the reason for that is because its success is not dependent on just a handful of patients paying a high dollar amount. It is supported by a raft of many patients. And so there's always going to be natural cycles of patients that come in regularly for a while, and then they don't, and they stop coming in, and then new people come in. So when you lose one patient or even a few patients it's not devastating to your bottom line. Other patients are going to cycle in and fill in those areas that another patient left. Oops. And one more benefit of community acupuncture is community. People who practice community acupuncture are very supportive of one another. We collaborate. We love talking to each other. We love getting ideas from each other. We are each other's cheerleaders. So it really helps to have that community when you're doing this work. And that's why I created the Community Acu Hub, so that we could have more ways to connect. So I want to talk about Medicare, but I think this might be, no, we'll go ahead and talk about Medicare and then we'll take a break. Okay, so let's talk about Medicare for a second. There is currently a big push in our profession to have acupuncturists be federally recognized for inclusion in the Medicare system. And that's that January town hall meeting that I referenced. And at that meeting, they presented a case for why this is important. And again, if you haven't watched it, I encourage you to watch it. It's very good information. So I think it's important for all of us to know what our professional organizations are doing and what they're pushing for and what they're moving us toward. So here's what Medicare currently pays for acupuncture. This is according to Holistic Billing Services, which is an insurance biller that a lot of acupuncturists use. And this information is taken directly from their website. So you can see here what each of the amounts are. Acupuncture pays $37.80, or Medicare pays $37.89 for acupuncture without e-stim for the initial 15 minutes, $28.87 for each additional 15 minutes. And then the prices go up a little bit, or the reimbursement rates go up a little bit if you're using e-stim. So this is defined by Medicare as personal one-on-one contact. And that means that Medicare pays you for 15 minutes of being with your patient, and it doesn't pay you once you leave the room and let the patient rest. And also, if you bill an additional 15 minutes, that includes reinsertion of the needles. So that additional 15 minutes would be you coming back in and spending 15 more minutes with the patient, which includes reinserting the needles. So maybe you do a front treatment and a back treatment, or maybe you do a few needles on the first 15 minutes and a few in the second 15 minutes. And again, prices are a little bit, reimbursement rates are a little bit higher for e-stim. But here is the whole point of this, is that these reimbursement rates are pretty much in line with the price of a treatment at a community acupuncture clinic. So it's pretty much equivalent with what community acupuncture clinics charge. Also with Medicare, patients are responsible for a 20% copay for each session. So this is just a little comparison chart looking at Medicare versus community acupuncture. So Medicare pays for acupuncture for chronic low back pain, and that is defined as pain for at least 12 weeks that isn't associated with another cause. With community acupuncture, we treat everything. Medicare is limited to 12 sessions in 90 days, plus an additional 8 sessions if the pain improves. And there's a limit of 20 sessions per year. After that, then the patient will have to pay out of pocket for their acupuncture or for anything that's not chronic low back pain. With community acupuncture, of course, we have no limits on how many sessions a patient can get. With Medicare, acupuncturists currently must have what they define as appropriate level of supervision. And that's what the ASA is working to try to change. But currently with community acupuncture, of course, we have no supervisory requirements. You just practice within your scope of practice, wherever you're practicing, and that's what you do. And then Medicare requires verification of eligibility. You have to collect the copay from the patient, you have to bill Medicare, and you have to wait for reimbursement. Community acupuncture is much simpler. You just collect payment at the time of service. So there's no guarantee that Medicare is going to cover anything in addition to low back pain. It probably will, but we don't know. It has limitations. There's a supervisory requirement, and this supervisory requirement with Medicare is literally going to take an act of Congress to change. So there's a lot of hoops that you have to jump through for Medicare. I'm not saying don't do it, but it's a much more complicated solution than community acupuncture. And even after this, acupuncturists who choose to bill Medicare, like I said, they're going to be reimbursed at rates that are commensurate with community acupuncture rates. So therefore, if you want to take a lot of Medicare patients, you're going to have to practice in a high volume way, because if you're getting paid, $30 or $40 something for a patient, you can't treat 1 or 2 per hour. You'll never earn enough to make a living that way. So a high volume practice is going to be necessary if you're going to bill Medicare. So it benefits practitioners to learn these principles of community acupuncture so they can apply them to a Medicare-based practice if that's the way that they choose to go. All right, why don't we take a break here? Let's take a 15-minute break. So it's we'll come back at 30 minutes past the hour. And while we're on break, if you have questions, please type those into the Q&A, and then I will answer those when we come back from break. I'll see you in 15 minutes.
Recording stopped.